to Prevent and End Homelessness reported that the January 23rd, 2019 point-in-time survey showed a 5% increase over the 2018 survey. The number of homeless families with children rose, individuals homeless rose, and the total rose from 987 last year to over 1,000 this year. This is the second straight year of homelessness increasing after steady declines from 2008 through 2016. Some of the factors attributed to this include a shortage of affordable housing options, a lack of resources to support move-on strategies for those that could exit permanent supportive housing, and is contributing to a steady increase of chronic homelessness. Despite increasing the collaborative application score in the past several HUD competitions, no additional federal money was awarded. And although there was one less household with children counted in 2019, there were larger size families who were being served. So my question to you is, what do you see as the most important first step in addressing homelessness in Fairfax County? And you'll each have 90 seconds to answer. Okay. Important first step, shouldn't take long.
Okay, I think one of the first steps we need to do is address the symptoms of homelessness. Systemic homelessness doesn't happen overnight. It is built up over years. Wraparound services to provide the needed changes to support elevating and removing the barriers to become permanent entry, removed so they become permanent placement and no longer requiring support for temporary housing. Homelessness is homelessness is a situation that has occurred as a result of services, barriers, mental health, and economy. And we have to address it on each of those levels. And so the first thing would have to be wraparound services to address the social barriers that are necessary. The second step would be to address the economic barriers. The third step would be to address the mental health barriers. And the first step would be to, most importantly, hear from the voice of the advocates of the homeless community and work with them collaboratively to bring innovative solutions to an issue that has existed for years. We can keep doing the same thing over and over again and get the same result, or we can do some things differently and find a different change. And so my solution, first sit down and work with all the homeless advocates and find avenues of what collaboratively innovative ways we can bring new solution. Wraparound services, address mental health issues, as well as economic barriers. Thank you very much.
90 seconds. So this is a very multidimensional issue. Homelessness is not just an issue of not being able to afford to live in your home. It's an issue of all of the other things that are putting strain on everyone's paycheck every day. There was a study that came out yesterday or recently that said that for a family of 4 living in Fairfax County, you have to earn $114,000 in order to have a somewhat modest but adequate lifestyle. $114,000, yet there's this benefits cliff that happens where we don't cover payments for a slew of different things if you make over a very, very low amount. For example, Head Start. You can't get your child into Head Start and get free preschool for them if you make more than $25,000 a year. So the gap between the $25,000 and the $114,000 is where a lot of our residents fall. And the same problem is with rent subsidies. The wait lists and vouchers for rental assistance have been closed for the last decade until recently. There's so much that we have not done over the last decade, and it started to move in the last year, and I dare say it might be because it's an election year, but I think we're making some progress, and we need to keep making that progress. After June 11th or after November, we can't stop. We can't sit back on our laurels and stop putting pressure on the elected officials, because now it'll be another 4 years before there's another election. We have to keep providing those benefits to make sure people don't fall off that cliff where they make an extra $5,000, but yet they lose $20,000 worth of assistance that was keeping them going.
So this is a very vexing and a very difficult issue. So from the standpoint of recognizing first that housing is foundational, that people need to have housing in order to be able to attend to other things in their lives, we've got to make sure we address that item first. So we've got to have a funding mechanism where we can actually help the not-for-profits place some of these folks who are homeless into either emergency shelter situations or to place them into a program that has the supportive services that were discussed earlier. So if we think about folks who are homeless, they tend to have issues around underemployment, they tend to have issues relative to mental health, and they could also have issues relative to substance abuse. So we've got to be able to treat those issues and help them address those in order to become able to be self-sufficient and to take care of themselves. Thank you.
I can say ditto, but I'll just expand on it just a little bit. It is a complex issue, and it goes to housing affordability, which is one of the critical issues facing not just Fairfax County, but nationwide. No one's been able to find the silver bullet to solve that, and they'd be billionaires, but they haven't quite made progress on that enough to capture what we want to have happen, which is zero homeless in the county. What we have going on right now is two things. I think it's the housing affordability issue, which we have to get funding for, and the wraparound services that Kelly had mentioned. They all need to intersect, because the people that are teetering on the edge that do have a home or have an apartment or a condo, they're making rent, but if they don't make that rent 1 month or 2 months, they're evicted, and they start going down this spiral of negativity, and we need to make certain that we have funding for transitional people to stay in the housing so they don't fall down that rabbit hole in which they can never come back out of. I think that moving forward, this has to be, because we're a compassionate, caring community, this has to be something that we focus on, our priorities with our funding and with our social services. Thank you.